Okay. I want to welcome everybody. My name is Gina Owens. I serve on the steering committee of Healthcare as a Human Right, and I'm on the Washington CAN board. I've been a board member for about 15 years. We're here in this most urgent moment to help facilitate our lawmakers working together and agree on real legislation that will allow us to go beyond stating our support for universal health care to the stage of actually achieving it. Welcome to this very important event. Yay, everybody, for being here. Cool. Pay attention, everyone, to the very bottom of this slide at the website there. Our coalition is spread out around the state of Washington. We ask for those engaging in this event to reflect to the lands on which we reside and acknowledge all of the ancestral homelands and traditional territories of Indigenous peoples who have been here since time immemorial. Healthcare as a Human Right acknowledges the coastalish peoples of this land, the land that touches the shared waters of all tribes and bands within the Duwamish, Puyallup, Suquamish, Tulalip, and Muckleshoot nations. Acknowledging the ceded and unceded land on which we all stand could not be more important in our current historical moment. We encourage you to consult the website that's on the bottom of the slide there, where people can enter in a zip code and see which tribal land you're on. The slide also includes 29 federally recognized tribes and notes the tribes currently without federal recognition and tribes with ceded land in Washington state: Duwamish, Wanapum, Chinook, Coeur d'Alene, Nez Perce, Umatilla Confederated, and Warm Springs Confederated. Regardless of their status, their stewardship of the land remains important and must be recognized. Now we're gonna switch gears a little bit here. A quick word about Healthcare as a Human Right Washington. We organized this forum today, so I'm glad everyone made it. We're a statewide community and labor organization campaign to make healthcare a right to all people in our state and in our country. We're part of a growing movement for the healthcare justice. We believe the fundamentals of our health system must be built around delivering healthcare to everyone in our country in an equitable way. We want healthcare for people, not profit. Because really, how do you put a dollar bill on somebody's life, right? We're here to talk about transforming the system so that it will meet the unique needs and health risks of every human being with no barriers to entry. The need for healthcare justice is greater than ever. The pandemic has laid bare how much our own health is interconnected with everyone else's, and how access to healthcare is shamefully unequal, depending on your race, occupation, where you live, and other reasons that shouldn't even apply. We're a universal public plan, publicly funded and administered. In other words, expanded and improved healthcare for all. I'm pleased to introduce to you all Bevan McLeod, who will moderate our panel tonight. Bevan is the co-founder and board president of Alliance for a Healthy Washington. She worked with Representatives Jayapal and Khanna on the state-based Universal Healthcare Act, was a member of the Universal Healthcare Work Group, and was leading advocate working on the Universal Healthcare Commission bill. Take it away, Bevan.
Thank you, Gina. Much appreciated. So we're really excited about the gains in healthcare that are on the agenda in Congress, especially expanding Medicare benefits to include vision, hearing, and dental, lowering the Medicare eligibility age, negotiating lower drug prices for Medicare and all health plans, and supporting states that want to achieve universal health care. Our main focus in today's discussion will be on our work at the state level to achieve affordable and equitable healthcare for all Washingtonians and what Congress can do to help. So in the interest of time, I would love to go to slide 1, please. I just wanted to give a very quick overview. So essentially what we have done for folks who don't know currently is Washington State now has the first in the country permanent universal healthcare commission. And we were able to get that passed with a lot of help from several folks here, including some panelists that we'll be speaking to. And we also have now the new state-based Universal Healthcare Act that has been reintroduced into Congress this current. The Universal Healthcare Commission, not super here to talk about that, but essentially we are going to be starting the first meeting, hopefully sometime in October, still waiting for the governor to make the appointees known. The effective date was officially July 22nd. And so we're looking to the work of that commission to really develop the plan for a unified financing system once the federal authorities have been realized. You all can read. I'm happy to answer questions offline as well. But essentially, this is not just another study. This is a permanent commission to look at and synthesize the reports and the analyses that have already been done in Washington State over the last many years and put together a plan and propose steps that our legislature and state agencies can take to achieving that unified financing system. So that said, I think we're going to dive into this conversation a little bit more during this panel discussion, but our state needs help. We can't finance this by ourselves, as I think everybody here knows, and so we still need the federal waivers to be able to get that into place. So essentially what we're looking at is Ro Khanna's State-Based Universal Healthcare Act, which originally was McDermott's bill, and then Representative Jayapal worked on a new version of that in 2018, which we were able to assist with, and then passed that over to Rep. Ro Khanna out of California in 2019. He has reintroduced this Congress. One of the pieces of that I think is incredibly unique is that it would allow for multiple states to apply jointly for a waiver, and so would allow, let's say, Washington, Oregon, California, maybe pie in the sky thoughts to have a regional healthcare system. But these waivers are incredibly important for us to be able to do the work that we are ready to do at the state level. So that is it for this kind of brief overview. And I just wanted to jump into conversations. I know that Representative Adam Smith is here. Thank you so much. And I know he has to jump off soon. So I wanted to make sure that we get to the questions and have some time for him to respond. And Congressman Smith, I just want to make sure that you know that if there are any questions you have of any of the panelists before you leave, I want to make sure you have an opportunity to ask. Tonight, we're going to be hearing from 7 folks, and I will be introducing each of them as they come forward. So let's start with you, Congressman Smith. You represent Washington's 9th Congressional District, which includes Southeast Seattle, Redmond to Kent, Burien to Tacoma. You serve as chairman of the House Armed Services Committee. And just, I want to thank you personally for all of the work that you have done on healthcare and the fact that you are one of our delegation that has signed on for Medicare for All and signed on as a co-sponsor of Ro Khanna and Jayapal's State-Based Universal Healthcare Act. So thank you. So I just want to ask you, really, how is the state-based bill, which builds on the ACA, a significant step towards Medicare for all and overall cost savings to our healthcare system?
Sure. I mean, there's 2 really big things that I think are helpful: access and cost. And the expands access by giving the states flexibility. Our healthcare system across this country is unbelievably complicated. That's part of the problem. You'll oftentimes hear people say, if we were starting over from scratch, this is what we would do. That's sort of what the British did with their system after World War II. As they started over from scratch, they put in place a single payer system and made it work. We, on the other hand, have interlocking, 50 state systems. Certainly you have federal regulations. The ERISA waivers are crucial to get anything done. So basically, to free up innovation on the state level is what's so important about this bill, is it would allow individual states or even states to join together to innovate to innovate in ways that expand access and control costs. And I think we need to do that. I think a one-size-fits-all approach is going to be difficult to come by. The ACA was enormously helpful. There are certainly things we can do. I think there are things in the human infrastructure bill that we just set in motion with the budget reconciliation today that can be helpful with that as well. But you just got to allow the states to innovate. I mean, if in fact we could wipe the slate clean, put in place federal legislation, but the United States has always had a combination of federal and local government. But what's happened is, because of the federal control on healthcare and because of the requirement for ERISA waivers, we've sort of taken a federal approach, but the federal government isn't covering everybody. They're not doing everything. They're not using that authority to get to universal access to healthcare. So in essence, all it's really doing is blocking the states from their ability to innovate and come up with new ways to contain costs and expand access. So I think it is a crucial part. I mean, I would just say, look, if we had a vote on Medicare for all tomorrow and it was passed into law, we probably would, it wouldn't be as important to pass this, but we don't. So let's let innovation drive access and cost containment on the state level. Because as you know, Bevan, I mean, state of Washington, a bunch of different places have come up with a lot of good ideas. We need to encourage that.
Yeah, and I'll just say, for a point of reference for folks who don't know, the Pathway to Universal Healthcare Work Group did work with economic analysts, and just at year one, the approximate savings of a unified financing system for a state-based universal healthcare system, including implementation costs, was approximately $2.5 billion, and then $5 billion annually statewide. Now, we don't know exactly where those savings go, right? We couldn't analyze how much of that goes to individuals and the state itself, et cetera, but that's just at a state level. So I guess I'm curious to hear from you, Congressman Smith, about what your thoughts are around, if we could really wrap our minds around the true costs of care in the country and really start to implement, innovative programs like Washington State is ready to do. How much do you think we could save in the long run?
It's really hard to calculate that, but I think there is enormous potential. And we have seen, on the state level, sort of little dribs and drabs, bits and pieces. Counties have adopted, certain proposals that have helped to control costs. I think it was back in Maryland where they instituted a plan where they figured out that like 10% of the population was responsible for 70% of healthcare costs. So they went, okay, let's go to that 10% of population. Let's basically give them their own individual doctor, which wasn't exactly the way it worked, but it was a focus on that 10% of the population. We've seen things like, improving primary care by giving people, the ability to pay a flat fee for access to primary care, different ways to compensate primary care physicians so that you encourage better primary care, which of course saves money by reducing reliance on specialty. It's just let 1,000 flowers bloom, if you will. And the incentives are certainly there. Every local government, every state, they're under a ton of pressure because of their healthcare costs. And this would give them that opportunity to really get those costs under control. And we've seen those ideas out there. We just need to get to scale on them.
Yeah. I always think about R&D as well. I want to pivot to State Senator David Frockt, who serves in the 46th Legislative District. He's the Vice Chair of the Health and Long-Term Care and the Senate Ways and Means Committees. Senator Frockt, it's really good to see you. Thank you for being here. Thank you for your tireless work to bring affordable healthcare to our state, given everything we have already done to improve our healthcare system, including implementing Cascade Care. A nod to you as well, Representative Cody. Why does Washington State need additional federal waivers to achieve the mandate that the Universal Healthcare Commission has?
Well, Bevan, first of all, thank you and to the group for inviting me. It's great to be here, and it's great to be with Congressman Smith. Thank you, Congressman Smith, for all the work that you're doing for us back in DC. I guess I would say, there's been a lot of discussion about cascade care, and I thought maybe I would just, as I get to your question, let me just set it up. One aspect of this, I think that as I thought about what we did with cascade care, which were really three components: additional state subsidy, which is now complemented by additional federal subsidy, which is really, really important. It's going to also help us. The state subsidy will help us pick up potentially people who don't have status, legal status in this state, so that they can have access to a healthcare plan. That's part of accessing universal care. We also created more standardized plans, which are currently lowering the cost for those who are in the individual market or buying qualified health plans by up to $1,000 in terms of out-of-pocket costs. Those are really, really important because people don't actually realize how much they're paying when they're on these on the individual plans in the individual market in terms of out-of-pocket costs, deductibles, and the like. So those two things have been really good. And then the one that's gotten the most, I think, coverage has been the public option, which is a new, I would say, an innovative thing that we're doing here. We're really the first state in the country to do any version of this, and it's been talked about widely. But what I guess I want to say is that I think that the efforts that we're taking here today with this are to build on the existing system and improve it, particularly for a limited subset of people, just those 300,000 people or a little bit more than that are in the individual market who don't have access to another type of plan. It's not to the detriment, in my view, of a universal approach, which is what we've got with the system, the new Universal Commission, which I co-sponsored and worked with the Senate sponsor for both versions of it in the last 2 years. So I've been very supportive of that. They're just two different tracks. One is sort of building to try to improve what's currently happening, but the other is transformational. And that's how I see the universal approach that we're taking, which is what I think, many people want us to do. And I would like to do. And I also think that the Cascade Care program, the public option, if you will, we're still working the kinks out. There's some problems with it, some things that we're discovering that I think are going to be important for the national conversation in terms of how to get hospitals to and other providers to actually participate. We didn't mandate participation initially. That's a problem, but that would be an issue that will come up in any discussion of a universal system. How do we get people into something that is akin to Medicare, for example, for the entire state? How do we get providers to participate? And at what rates would they reimburse? These are all questions that are being debated and discussed and analyzed in the context of what's happening on that. So, and what we're currently doing. So
1 minute to go.
Okay, so let me get to your direct question. That's okay, no problem. Let me get to your direct question. I wanted to kind of set this up. The main point I would say is that any universal system, you've got to deal with federal streams of money that are coming into people with Medicare, Medicaid. These are huge, huge dollars, and also the hundreds of millions of dollars in state subsidy that are going to those who are in our individual market. So if you're going to take all that money that goes into what providers are paid and how we actually facilitate a payment in the system, and also how people derive care, you have to consider the federal streams of money, because these are not costs the state could bear completely on its own without any kind of diverting of those federal streams. And so what the state-based program does is it gives us the option to develop plans for how those streams of money would be utilized and repurposed, if you will, in a universal, hopefully more efficient, more broad-based and universal system. That's the key thing here. And I think anyone who's looked seriously at states doing something experimentally with a universal-based system or a regional plan, you just can't do it without discussing the huge amounts of federal money that we get. The second biggest item in our state budget is our Medicaid budget, and half of those dollars, maybe 60% in some instances, come from the federal government. So you can't be repurposed without it.
Hey, perfect timing. Thank you, Senator Frockt. And yeah, absolutely. I think we all know that, when you expand the risk pool to even, something the size of the state of Washington, that, cost per person, of course, makes it more affordable. And if we can transfer those dollars that are already being spent, right, into a more streamlined approach, I think that the data are pretty clear about where those savings come in. So thank you for that. Representative Cody, I want to welcome you and thank you for your decades and decades and decades of work on healthcare in the state. Sorry, maybe that's too many decades.
I was going to say, don't make it too many.
Your decades of work. Much appreciated. Representative Cody serves the 43rd legislative, you don't know you're not, you're the 34th legislative district, which includes West Seattle, Burien, and Vashon. She is the chair of the House Health and Healthcare and Wellness. So Representative Cody, one of your key amendments to the commission bill calls for the state to apply for federal waivers as they become available. And I'm wondering, how could a waiver that allows for multiple states to file jointly be a game changer for universal healthcare, in your view?
Well, thanks, Bevan. I think that the big idea is just to be able to get some of those waivers, if Congress would pass that legislation. Because as everyone has said so far, the real problem for us is that we have to have the Medicare and Medicaid money and actually need an ERISA waiver to bring, if we're going to really have the whole pool, we need all those waivers. And I'll go back to the 93 Act that was passed. I wasn't there, but Adam was, voted for it. But that was what got me into politics, was that back in 93. And we were looking for waivers then. So that's part of our problem, is that we have been really waiting for Congress to allow us to try and do something different and give us those waivers. So whether if we could have it for multi-states, that would be great also. But I mean, we just can't get anywhere until we get the ability to get that money. I think that David said it well, and Congressman Smith, is that we just have to have the federal money because that's so much a part of our budget. But then along with that is also what are we going to pay for, the rates. And that's the other place that, under the cascade care discussion, we certainly got into an argument with the hospitals and the providers on what the rates should be. So that's one of the things, we're hoping is that with the cost transparency board that we have, that's up and running now, that they will be able to at least show us what we actually are spending and how can we bring down some of the rate increases. It's hard to dial people back from the income they have now because they fight like tooth and nail. But, there certainly are groups that could use a little trimming and certainly don't need increases in their rates. And I know that everybody looks at the insurance companies first, but the hospitals are just as guilty, hospital CEOs and the money that we put into the hospitals. So there's a lot of places where we need to start trimming, and hopefully we can. It's like I always say, I want people to have a fair wage. That doesn't mean they have to, take it off of the hides of other people to get it. So
1 minute.
That's one of the things that. The other thing I would say is that hopefully, I know that we have passed in the legislation and the budget that we undocumented, trying to get our undocumented covered. And that's a waiver that we probably can get if the Biden administration will grant it, because it would come through CMS and can be a 1332 waiver. The only other state that's asked for it is California. And that went in on the last day of the Obama administration, unfortunately. And so they pulled it back because we know Trump was not going to give it. So hopefully we're going to be moving forward with that idea and be able, because really our undocumented people in the state of Washington are 20 to 25% of our uninsured. So we have to be able to provide something there. And if we can increase our subsidies that we have done with, and actually as long as the feds continue with the increased subsidies that we have on the exchange, I am very hopeful that we can start having, moving down our number of uninsured. And I mean, we're better than we were, that's for sure, after the Affordable Care Act.
Thank you so much, Representative Cody. And Congressman Smith, I know you're limited on time, but I wanted to just give you a second if you have any questions or comments for any of the other panelists before you have to jump off.
The one question I have, and I do have to go, I have to jump on a call, is so we're working on this piece of legislation to free up the states. And obviously we've been focused on COVID. We've been focused on, the infrastructure packages, both of them. But what other than that, in terms of expanding the ACA, what is your federal priority beyond this in terms of how we change the ACA on the federal level or move towards universal access? Do you have an idea of what your agenda would be beyond empowering the states on the federal level?
Well, the first thing I'd say is get rid of the part of the ACA that says that the exchange, that undocumented can't go through the exchange. That's what's requiring the waiver that we're working on now.
Yeah.
That's kind of a simple one as far as I'm concerned. I mean,
Yeah, that's because you live in Seattle.
I know, that's right. I know. But
Yeah.
it's easier than trying to put rate setting in. Let me just put it that way.
Fair enough.
I would just add, Congressman, I would just add that and I don't know if I actually was trying to find out if it was in the reconciliation bill that I think just passed, but the maintaining and extending the Biden subsidies that Eileen mentioned is really vital. That's really going to have a real world effect on a lot of people who are buying or getting currently their insurance on the ACA exchanges, and certainly our exchange here in the state. That will really drive down their costs. We estimate that people at 250% of poverty level, which would be outside of the Medicaid window, will almost have no copays and no premiums with the combination of the Biden subsidies and the state subsidy that we're implementing. So this is really good, and if those can be extended for 10 years or permanently, make a huge difference.
Yeah, I believe it is part of that reconciliation package, but I want to make sure everyone understands that what was passed today was the budget resolution that sets the framework. It does not pass it into law. It sets the framework for the budget. Now 6 or 7 committees have to individually put together how to spend that bill, and it has to pass. So we still got a long way to go on that.
Do any other panelists have any feedback to Congressman Smith before he has to jump off?
Yeah, I'll say more as well on the money front. Some of the increases that were put through the COVID relief bills, the series of COVID relief bills, most recently the home and community-based services investments have been critical. And as we continue to navigate our way through COVID, having that additional resource for our long-term care system, our community behavioral health system is going to be essential, and that federal assistance is really keeping us afloat in those areas.
Yeah, and I understand. I guess I'd close one comment. I mean, we have appropriated $6 trillion in the last 16 months now, and I think it's really important on the state and local level to spend that money. We saw the article about the housing problem. And look, I understand. I mean, we went through this with unemployment. You can't just, throw the money around wildly. You want to make sure it's going to where it's supposed to go. But anything we can do to unclog those gears and get that money out into the community. There's a lot of money in there for what you just mentioned, a bunch of different things. I want to see it going to the people who need it.
So I will just say, from an ACA perspective, and of course, I am not an elected official, but I think that, in any way that we can streamline the waiver application process for states that are ready to innovate. I mean, I recognize that, Arkansas and Mississippi are not in the same boat as Washington and California and Oregon, right? So, but states that are ready to innovate and do have plans that our legislatures have basically passed at this point, except for saying, hey, we just need some federal dollars. Any way to streamline that application process, I think would untie our hands significantly.
Understood.
Okay.
Thank you.
I'm going to move on. Thank you so much. All right, our next panelist, Representative My-Linh Thai, serves the 41st Legislative District, which includes Mercer Island, parts of Bellevue, Sammamish, Newcastle, and Renton. She is the Vice Chair of the House Democratic Caucus. Welcome. Thank you so much for being here, Representative Thai. And Mohammed Shidani, Deputy Director of the Somali Health Board, is actually going to be asking a question of Representative Thai. So welcome, Mohammed.
Hi, thank you, Representative. The quick question here is, first of all, as Biffin said, my name is Mohammed Shidani. I'm the Deputy Director of Somali Health Board. And my question to you is, can the state-based universal healthcare bill help our state cover all Washingtonians? Reason I'm asking that is because we've always seen on a grassroots level how much disparity exists within these smaller ethnic communities like African refugees and immigrants. And especially during the COVID-19 time, we've seen how much impact that has to everyone because our health is really interconnected. Thank you.
Well, thank you, Mohammed. And thank you to everyone who on this Zoom, not on this Zoom, who is being an advocate, an activist, legislators who put your heart, your mind, your life to ensure that healthcare is human right. And I am honored to be in this space with you. And thank you for the question, because Representative Cody and Macri knows how important this particular topic is to me. It certainly is my top priority in my legislative work. You know, I don't think I would spend my time convincing you to join me in this work. I want to use this time to really remind us of how we keep talking about the systemic racism in our country and how we experience it at multiple systems, healthcare included. And if we recall, there was a period of time when we talk about, oh, we want our work, we want our legislations, we want our policy being database. So if we take a more step back, if the undocumented individuals who live in our state, in our nation, the immigrants who live in our state, in our nations, the people of color in marginalized communities who live in our state and our nations, not having health coverage, and from the public health perspective, how they don't have access to preventive care. So what will our data show us? Our data will continue to show us that these people, those people, are the problem for our community, for our state, for our country. Right, and it's in itself, the argument in itself, yes, it's the database, but it's database based on the system that never include them. So why do we need the healthcare that would include everyone? Because when we talk about saving, we talk about dollar saving. What does it mean? Who does it go to? But we forgot that very fundamental civil rights, because when we talk about healthcare as human rights, we need to keep highlighting that very, very basic civil right that afford everyone the opportunity not to be in the data that would point it to them as if they are the problem when they themselves was not being included in the beginning. So I realized I didn't really particularly answer the question, but I feel that it's so critical that we need to be reminded back in that space and why this work have to include undocumented individual, include immigrant individual, including community who has been marginalized, has been excluded in many of our policy conversations. And so racial equity has to be part of the topic, not simply social economic community.
Thai. And thank you so much for reminding all of us about that core of the basic humanity of looking out for one another. Yeah. Mohammed, I want to give you an opportunity. Do you have any follow-ups or anything you want to bring to Representative Thai?
No, thank you very much again, David, and thank you, Representative Thai. Well, you actually have answered it really well. But yes, while we had difficulties, putting the message across before COVID, because I was also within the Universal Health Group, Universal Health Work Group, it was a little bit harder to tell the stories of people like us, immigrants, refugees. We have a lot of refugees that come here through the proper channels, and then we have undocumented. And usually, these are all in the same communities. They all live in the same houses because we are very communal, and not giving coverage to all of them just doesn't work for the communities in Western Washington. And this is a great state compared to the things we are seeing, reports we're seeing from other states. But I appreciate the time, and thank you very much for answering my question.
Thank you very much for being here. Much appreciated. So our staff from the Senator's office couldn't make it, and so we're going to go straight to Larry Brown. Thank you so much for being here. Larry is the president of the Washington State Labor Council, which includes 600 affiliated unions, representing over 500,000 workers in Washington State. So Jim Howe is a member of the American Federation of Teachers of Washington, recently retired from the Lake Washington Institute of Technology, and serves on the Healthcare as a Human Rights Steering Committee. And welcome to you both. Jim, I'm going to hand it over to you to chat with Larry, please.
Thank you, Bevan. So I've told this before. I got involved. What do I have to do with healthcare? I'm a retired faculty. What struck me the most was retired, laid off, and part-time faculty and staff losing healthcare in the middle of a pandemic. So that was the spur to this whole thing. We want to recognize unionized healthcare providers, essential workers, and the State Labor Council for their leadership in responding effectively to COVID from the beginning. This summer, during the pandemic, delegates to the State Labor Council Convention adopted a resolution in support of Medicare for All, Medicare expansion, and the state-based Universal Healthcare Act we've been talking about. Larry, you have strongly advocated taking healthcare off the bargaining table. What are the next steps for Washington's labor movement on healthcare? Thank you.
Thank you, Jim. I appreciate the question, and I want to thank the Healthcare as a Human Right organization for the work you do, and a special thank you to our elected officials here with us tonight. Thank you for your service. The Washington State Labor Council advocates for everyone to have care that is affordable, accessible, and high quality. We know it is crucial for everyone to have a say in their own health care. But right now, unions are the only place working people really have a voice in their care. This community-driven approach should be a model for all healthcare. The Washington State Labor Council has a history of supporting universal health care and the concept of Medicare for all. With the labor movement, within the labor movement, there are diverse healthcare experiences. Some union members have sacrificed wage increases in order to win excellent benefits. Others have faced painful cost shifting at the bargaining table. Within the labor movement, many unions welcome the opportunity for Medicare for all, while others have concerns about that transition and what it would look like, and whether it would eliminate the strong plans that they as union members have fought for. We know that working people deserve to thrive, and healthcare is a big part of that. The question is, how do we work towards healthcare for everyone and do so together? We welcome the conversation. WSLC is the place for us to work through big questions and issues together and identify opportunities for collective action. I want to bring this back, though, to the question that you started with, lifting up healthcare workers. Today, The primary labor priority specific to healthcare is the workforce because of the conditions we're living with right now. Our healthcare system is at a crisis point across our state and country. Hospitals do not have enough staff to maintain standards of care. With the resurgence of this pandemic, we need to support and protect today's healthcare workers so their jobs are sustainable. And we need to build a pipeline of new healthcare workers to join them. We need good staffing levels in healthcare so we can all have the quality healthcare that we need. Thank you.
Thank you. Thank you both, Jim and Larry. So our next panelist I want to invite forward is Representative Nicole Macri. Nicole serves the 43rd Legislative District, which includes several Seattle neighborhoods. She served as Vice Chair of the Healthcare and Wellness Committee and is a member of the Appropriations and Finance Committees. She is also a member of the Washington State LGBTQ+ Caucus. So welcome, thank you for being here, Representative Macri, and thank you for all of your work in this space as well. So Representative Macri, how can we ensure greater accessibility to mental health care for all who need it, while also making the system work for mental health providers, as well as greater cost control?
Thank you for that, Bevan, and thank you for having me here tonight. It's always good to be among you. I'm so grateful for the advocacy of the folks in this Zoom room and beyond in pushing for universal health care and for equitable and affordable access for all Washingtonians, leaving nobody out. So it's always great to be able to connect with you. And I really appreciate this question about mental health care, and I'll actually expand it more broadly to behavioral health care. As you all may know, we continue to see crisis levels of substance use in Washington State, and we have done a lot of work to integrate not only mental health care and substance use disorder care, but also integrate mental health care, substance use, and medical care, physical health care. And that is essential. Having a serious mental illness is the #1 indicator for significant early death. And that is not because, although there is high risk caused by mental illness, particularly through suicide, death, but because people with serious mental illness live with co-occurring serious medical conditions that are more likely to cause early death. So this is essential for us to address. I would say there are several things. #1, integrated care, making sure that that when folks approach the healthcare delivery system, they can easily access mental health care. We shouldn't have a bifurcated system. The body is whole, the head is connected to the shoulders, or through the neck, I guess, but you understand what I'm trying to say here. The next is we really have a long way to go in Washington State. We have started, but we have to bolster our community-based healthcare system, because when people can get routine care where they live, they're less likely to have acute incidents that require hospitalization. And when they do need to go into the hospital, those hospital beds should be in their own communities. So we have a long way to go on community-based healthcare, but we've made huge strides in recent years. I want to echo what Larry said about workforce. We really need to support our workers in behavioral health, and we are doing some things, including building a new behavioral health teaching hospital in Washington State. It's an innovative approach that will help us build community-based beds, but also train healthcare workers specifically in behavioral health. Our healthcare unions have been leading in partnering with University of Washington on apprenticeship programs. We have a lot of people who come into the field in entry level and want to graduate up to higher levels, and they can learn quite a lot on the job, and we can create more formal apprenticeship programs in behavioral health. And then I'll say what we need to do is make sure that people can both meet their basic needs and we can improve social connectedness. So behavioral health overall is hampered when people don't have access to stable housing, when they can't get access to living wage jobs. And
lowered achievement
Oh.
until we all develop a deeper understanding of what
Somebody
it
else,
means.
can you mute yourself there, others? Okay, thank you. When we work on poverty reduction, like the federal child credit, these sorts of things these social determinants of health have huge effects. So we can't just look at the delivery system. We have to look at how we're caring for one another more broadly. So I'll leave it to that, and I'll say that others have captured it well, that it's all about equitable access, affordability, and sustainability. The other thing we'll continue to work on in workforce are looking at those, Medicaid rates and reimbursement rates overall specific to behavioral health. Eileen Cody brought up good points. There's unevenness in how reimbursement works across the healthcare sector. Some specialties are highly compensated, while some others, like family practice, behavioral health, are undercompensated. And so the work that we're doing at the state level with the Cost Transparency Board will help illuminate some of these disparities and help us ensure we're investing in the right area. So thank you for that question.
Yeah, thank you so much. And thank you for all the work that you all are doing in that space. So I also wanted to present Kristen Wells, who is a Washington CAN member and social worker. And I think she may have a follow-up question for you, Representative Macri.
Hello, like Bevan said, my name is Kristen Wells. I'm a social worker working in community mental health. I also have lived experience supporting my husband through his mental health recovery. We're currently paying out of pocket for my husband's necessary mental health counseling due to the shortage of licensed social workers in Washington and the Medicare requirement, which prevents him from seeking a provider with any other license through his insurance, such as the licensed mental health counselor his prior insurance covered before he switched to Medicare. So my follow-up question for Representative Macri is, what can Washington do to address the reimbursement rules that can often get in the way of accessing recommended care?
Well, I'll just be frank, Washington State can do really nothing on regs that regulate Medicare, because that's federally regulated. In other areas, including Medicaid, individual plans, large plans, everything except for our self-insured and Medicare, those ERISA plans that are off limits for the state to regulate, we can definitely make sure that people can get that access to a variety of healthcare practitioners. And we've actually been working on that at the state level. We have a behavioral health workforce task force that has been looking at how we can ensure broad access to credentialing for people who want to work in the field, because it's all about workforce. So some of what we have done, in part forced through COVID, is expand telehealth. So in areas of the state where there isn't access to licensed practitioners, folks can have remote engagement with providers. Sometimes, just like family practice doctors, being able to talk to behavioral health specialists can be quite helpful, because people can get a lot of care from family practice folks. I'm really sorry to hear about the experience that you and your husband have had with the health coverage that he has, but I think we are trying to avoid those kind of pitfalls, and I actually wasn't aware of that. I wonder if that someone smarter than me on this call may understand that limitation on the access to practitioner type, but that isn't an issue that we've heard as much. Definitely making sure the plans have access, which we really have pushed through the integration of the overall health delivery system.
Thank you so much, both to Kristen and to Representative Macri. And I would just say, I think this goes for everyone. You know, if you have questions that are not being answered this evening, which I'm sure are many, please feel free to send them to Healthcare is a Human Right campaign, and we'll do our best to get answers to you as well. And I think I know that our elected officials really love to hear from you all about the questions that you have and your experiences, your real lived experiences, and so that they can try and do better jobs. So I just want to finally close with our last panelist, last but definitely not least, Lynette Veers, who is the president of the Washington State Nurses Association. WSNA has more than 17,000 members and represents more than 103,000 registered nurses who live and work in Washington. So thank you so much for being here, Lynette, and I just want to thank you for all the work that we've done together as well. So for years, the Washington State Nurses Association has been a champion of universal health care and was a sponsor of the important resolution adopted by the State Labor Council this summer. You served on the Universal Health Care Work Group with a few of us, actually, that paved the way for the creation of the Universal Health Care Commission this year. What do you think the commission should do to achieve affordable and equitable health care for all Washingtonians? And how can Congress help?
Well, thank you, Bevan. Yes, you know, in part, it's kind of nice to be the last person. I get to listen to all of you that have had some really fun and brilliant things to say. First off, Representative Cody, thank you very much for the amendments you made on this bill, 5399. I think you really got down to about 16 plus things that you're looking at the commission to do. And I think they're all doable things. And certainly it's what the work group had been thinking of too. Second, Senator Frocht, thank you very much. I loved it when you were saying the buy-in from healthcare providers and hospitals, you know, with what we're going to set up for this framework. And I wrote a little note going, it reminds me of the vaccines right now. We're trying to get a buy-in on those too. So we don't have a magic bullet, but I appreciate your energy. And yes, Jim, Howell, you I'm calling all of you out. I had other things I was going to say, but you guys are more important. Yes, when COVID hit, oh my word, there are a number of things that came to light, and one of them, racism. We had no idea, and within our profession, the nurses, we had to come clean and start looking at what are some of the things that we just do routinely without looking at the research. So we've been trying to clean up our act, and it's going to be an ongoing thing. And the next thing is healthcare. And that has been my number one thing probably for the last 20 years, is knowing it's the only fair thing to do while at the bedside or in the clinic or home care or wherever we're at, of taking care of our clients. Absolutely. So I didn't want COVID, but I'll have to say those are some things that it showed us that we really need to work on right now. So thank you for those things. Now, in regards to give you an example, and I'll just leave you with this. We're talking about equitable. Well, what happens sometimes when you're at the bedside and you've got your team of physicians, nurse practitioners, physical therapists, OTs, whatever, and you're going, yes, this is our game plan. We are going to do this test to verify this medication, and let's get running with it. And we're all kind of excited. And then the case manager calls the insurance company and they said, oh, no, that particular patient doesn't have that benefit. So no, you can't do it for them. And that's when we realize we all need to have the same benefits. It's crazy if you're not working off the same song sheet. So I'm glad that we're all on the same song sheet. Thank you very much. And I know we're running late, so I'll let it go.
Thank you so much, Lynette. And I know we're a little over time because we've had some great conversations, but I just wanted to give one last minute or so to any of our panelists who wanted to ask another panelist a question or make a final comment about any of this. Is there anything that occurred to any of you that we really need to pass along to Congressman Smith since he had to leave early? So just give it a minute or two for some final thoughts or questions. Yes, Representative Thai.
Thank you. Because the conversation when Congressman Smith was still in the room was around ACA and ACA improvement. One piece that really weighed on my mind is really around public health. We need to see public health at a national level, at least in my opinion. I had the opportunity to live in Wyoming, Washington, and Montana. And again, we repeatedly saying COVID has showed us a lot of things. I believe that public health at the national level having much better coordinations and providing similar information, and information is so critical. With our vaccine, it's pain my heart. Similarly, seeing misinformations, and especially misinformation. And again, I sound like elitist right now, and I hear my thinking in my head. Is like if we don't even understand what vaccine does for us, what the point? And all of that we have learned a long time ago. And public health is critical in this space of making sure that people understand what vaccine does, because vaccine is not Tylenol or ibuprofen to get rid of something. It's yeah. Anyway, you don't need to reiterate that, but I think public health at the national level. Thanks.
Thank you, Representative Thai. Anyone else? Okay, well, if any of you change your mind, feel free to reach out to any of us, and we'll do our best to get any answers and or relay the information to the appropriate parties. So I am just super grateful to have been able to moderate this panel this evening and to be in this virtual room with you all, who each and every one of you is a thought leader in our state, and all of the organizations that have been here. And so please feel free to reach out to me anytime. If anybody has anything that they want to work on together or put heads together, always happy to be in that space. So David, I don't even need to check in. I know that we don't have any more time. I'm looking at our run of show. And so I think that we'll probably be sending out some notes. I know that this has been recorded, so we'll be sending out the recording in case anybody missed anything, and want to hand it back over to Gina. Thank you all so much.
Thanks, Bevan. I appreciate it. We have a slide with the congressional hotline on it, if that can be posted, because we know there's a lot of people in Congress who are healthcare champions, but they cannot overcome well-funded opposition unless all of us raise our voices now. So here's what we need to do. Call this congressional hotline, 202-224-3121. Ask your congressional leaders to support the State Universal Healthcare Act, HR 3775, and support the full expanded Medicare package, which is lowering drug prices for Medicare and all plans, vision, dental, and hearing benefits, very important, and lowering the eligibility age. Next slide. And that goes to Nathan.
Thank you, Gina. We're also inviting everyone in the audience tonight to join us for phone banking. It's every Tuesday from 3:30 to 6. So if you had a little time to join us today, we hope that time is open for you next week on Tuesday from 3:30 to 6. There's a couple senators who are not yet on board with expanded Medicare, and we'll be targeting them until we change their minds. What you would be doing is calling through a switchboard system that would reach out to folks in those states who are the constituents of that senator. And these are folks that are on board with our issues, just urging them to make that call to their senator. The information and the link is in the chat. So please, we'd love to see you get involved that way as well. And Also, there should be another link coming for bannering, which is another thing we do on Tuesday mornings, but I guess that's moving to Thursday now. So please check that out as well. And just thank you everyone for joining us. Thank you, Gina.
All right. So thanks to everyone for coming. As you can see, our HCHR member organizations on these 2 slides that are showing now. If your organization is interested in discussing membership, please reach out to us. Second slide. There's also a website that you can go to request our HCHR newsletter. Oh, there it is right on the bottom, bit.ly HCHR newsletter. You want to go to that and request it so that you can make sure to get all of our updates and newsworthy stories. With that, I am going to say a farewell. I love you all, but it's time to go.
Thanks, everyone.
Thank you.
Bye-bye.